I'm Dr. Sanat Krishnamulya. I'm a veterinarian by profession. I work as a wildlife health professional in India. I work with wild animals. So I have my bachelor's in veterinary medicine, and I also have a master's in wildlife medicine. So definitely One Health has changed a lot, my mindset especially. So I have now started appreciating the interface issues where wild animals have been giving diseases to humans, or even sometimes humans to wild animals. And it has made me, the course has made it much easier for me to understand the issues which are involved, appreciating the appreciating the interface issues, and to identify the key factors which actually lead to disease transmission among the interface actually. This course especially has brought me, has made me interact with a lot of people from other countries. That's, I think, a key issue in learning One Health aspects. One Health is an interdisciplinary issue, I do agree, but if it's only in one particular country, if you are even involving in multiple disciplines in your country, that might not give you broader perspective on what's happening around the world. But One Health as an issue, as a stream on its own, has to deal with all these issues. Everything has to be involved. You need to know what's happening in some other countries so that you can incorporate that to your country as well. Just as an example, India is a huge country, it's a biodiverse country, but still to the date we don't have a One Health action plan. But when I started my course, I came to know that Rwanda, which is much smaller but faces a similar problem, already has a plan in place. So in future, if India is going to come up with a One Health plan, I think I can definitely pitch in and give in more inputs to those action plans and make use of all these experience which I've had in my One Health studies with Edinburgh, and probably come up with a good action plan for the country. I am currently working on a human wildlife conflict mitigation project. So it's quite important to make people understand why it's why it is necessary to deal with such situations. Now, if I can explain to the people that okay, it's not only you encroaching their land, and if animals are coming into contact with you because of you encroaching their land, there is a possibility of you getting affected as well. It's not only the animals. You might have health issues in future, and there are recent examples in India like Nipah virus, which is drastically spreading. It's just because of these encroachments. So I think this studies will definitely help me to convey things in a layman language to the common people with whom I work at Human Wildlife Interface, for sure. Discussion boards have helped me a lot. I thought One Health issues or emerging infectious diseases as such, they are only issues in developing countries, but I now know that it's also an issue in developed countries. So it might not be same, but yes, they do have those issues, and we have to actually think at that level as well. This understanding definitely I wouldn't have got if I have not enrolled to the studies. So yes, it has helped me a lot in gaining a much broader perspective, for sure.